okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD. Whether it's for school, homework, or just everyday activities, FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFoco, thinkfoco.com for more information. Welcome. This is the Your Kids Will Be Fine podcast. I am Dr. Michael Malopsky, board-certified pediatrician, also parent of 7, grandparent of 3. Please find our podcast on all podcast platforms, including Apple and Spotify. Don't forget to find us at our website, yourkidswillbefine.com, where you can download episodes, leave suggestions for future shows, our YouTube channel at Your Kids Will Be Fine podcast. And we're looking forward to our discussion today about strep throat. School's back in session. Strep throat or questions about strep throat are by far the most common reason why people are coming to the office, especially this time of the year once school gets underway. I understand why. When you come to the office and your kid has strep, it feels like a really easy solution. I can get your kids back to school in 24 hours. Parents don't have to miss work. Kids are missing less school. It's way easier than hearing, your kid has a virus. You just have to wait it out. That can be frustrating. So, of course, wanting to know if your kid has strep becomes an important question for lots of reasons. So that's why people come and want testing and seek treatment. However, there's some specifics about strep throat. Why treat it at all? Why do we worry about strep throat? Especially when most people know that strep throat, if left alone, generally is a self-limiting illness, lasts between 2 and 5 days, will often go away by itself. So why do we bother? So let's get into it, all about strep throat. So we treat strep throat for 2 main reasons. That is to prevent what we call the suppurative and the non-suppurative complications. Before the era of antibiotics and routine use of antibiotics for strep throat, children often could get severe, life-altering complications and or die simply from a strep throat infection. And now that we have easily accessible and effective treatment, we see no reason, even if it's infrequent, to allow children to be exposed to the risk of those complications. So we test and treat strep aggressively. So what are those? So first, we have what we call the non-suppurative complications. Those are acute rheumatic fever, which is an autoimmune response to an untreated strep infection leading to inflammation of the brain, the heart, the joints, and the skin. Second is what we call reactive arthritis, which is also an autoimmune complication from untreated strep throat, and sometimes even treated strep throat, which can lead to inflammation of the joints. The third is what we call glomerulonephritis, which is an inflammation of the kidneys and can cause kidney damage. The fourth is toxic shock syndrome, where strep can get into the bloodstream and lead to a systemic inflammatory response, causing damage to multiple organ systems. The fifth is scarlet fever, which really now is treated just like a routine strep infection, but it used to be more of a problem before antibiotics, which just means that you develop a diffuse red sandpapery rash all over your body from a strep throat infection, but it's not treated any differently. And the last, which is more controversial, but I have more questions about than before, is something called PANDAS. PANDAS is a abbreviated acronym for Pediatric Acute Neuropsychiatric Disease Associated with Group A Strep. So what is PANDAS? PANDAS is thought to be an immune-mediated response in your brain that leads to an acute worsening of existing anxiety, OCD, or tic issues in your kid that's triggered by a strep throat infection. It's a little controversial, and we'll get into the details of that a little bit more. So now let's talk about the suppurative complications that we're trying to prevent. So those are things like tonsopharyngeal cellulitis or abscess, where you have an infection in the soft tissues of your throat or your neck. Ear infection, sinus infections, which can be direct extension from your throat. You can get something called necrotizing fasciitis. It is rare, but a strep throat can be a portal for the bacteria to get into your soft tissues and lead to a severe soft tissue infection, which can be deadly. Meningitis, which can be direct extension from strep in your nose, throat, and pharynx, and something called jugular vein septic thrombophlebitis, where the strep can actually get into the bloodstream, into your veins, cause a clot, which throws infected pieces of clot into your lungs. Very serious, is something that we see in teenagers, can be caused by other bacteria as well. But once again, these are all just categories of septic suppurative complications that we want to avoid, and other reasons to treat strep aggressively. Of the non-suppurative complications, by far the one that has the increasing number of questions and concerns about is PANDAS. We rarely see anymore, not that zero, but we rarely see acute rheumatic fever anymore. We rarely see post-streptococcal reactive arthritis. I rarely see post-streptococcal glomerulonephritis, which is inflammation from the kidneys. But there is a huge interest in wondering if my child's anxiety or tic or obsessive compulsive issues might be related to something that's treatable like strep, which is understandable. If that makes your child's symptoms, alleviate your child's symptoms, it's definitely worth pursuing. Not everyone agrees on how PANDAS is diagnosed, how it looks, or whether it even exists. But like most things in the world, the truth probably lies somewhere in the middle. There are general areas of broad agreement around what issues dealing with PANDAS. So let's talk about those first. First area of broad agreement is that group A strep is one of several factors that can definitely exacerbate an existing anxiety, obsessive compulsive, or tic disorder in some patients. Not all of them, but some. Chorea, which is a known complication of acute rheumatic fever, between 70 to 100% of the time also has psychiatric symptoms. So clearly there is a known connection between strep infection and psychiatric symptoms from long-term observation of these kinds of patients. We all agree that sometimes the pharyngeal strep infection that can precede the development of any non-suppurative complication that we talked about, from rheumatic fever to joint symptoms to kidney inflammation to PANDAS, can be mild or even subclinical. That is actually a thing. Not every strep infection that is clinically significant is necessarily apparent on the surface. So that's something to acknowledge. And not all strains of strep can act the same. Some strains may be more specific to triggering these types of non-suppurative complications. So everyone agrees on those points with regards to PANDAS and its relationship to strep as a complication. There are some areas of controversy, whether even this, first and foremost, is whether this connection is even authentic between strep and PANDAS as we know it. Is PANDAS a uniquely different entity from other neuropsychiatric conditions that we normally talk about, such as anxiety, OCD, and tics? How should that affect the treatment? Meaning, should you just treat it with antibiotics? Do you use anti-inflammatory medications like steroids? So these are all important to know. So there are ways to at least assess and test in a certain way whether there might be a connection. The first is parental observation of acute, abrupt worsening or onset of these symptoms with a known and tested strep infection, and their abrupt resolution if you just treat the strep infection, and that connection to certain rise in blood antibodies to strep. These are not, once again, 100%, but if you can string these things together, both with observation with the parents and with blood levels, can suggest that there is a connection for this child, so shouldn't be ignored. And the second most common issue that I see this time of year is the question around recurrent or repeated strep infections. This can be beyond frustrating and maddening, especially if you're a busy family and you have kids in school that you want to keep in school, since especially they just were off for the whole summer. And kids come in and it seemingly, as soon as they get off antibiotics, they get a second or a third or a fourth strep infection. And how to think about that and how to approach it. So there are specific reasons for people to show up, or children show up with a recurrent infection associated with strep. So one, non-adherence, meaning your child wasn't able to fully complete the course of medicine to treat the strep, which allowed it to come back. That's a thing. The medicines don't always taste great. Not every kid loves taking medicine, so sometimes it can be hard. But that can be a factor. The second is whether you actually get a new infection, meaning you get strep, you treat the infection, and you go back to a close classroom setting, and you are simply re-exposed to the same or a different strain, and you get a new strep infection. Third is that you could get a strep infection, you're treated, but the treatment doesn't work. It's a treatment failure. Why does that occur? Certain strains of strep can be resistant to the types of medicine that we use to commonly treat, and we have to switch medications. Some kinds of strep produce a substance that breaks down, let's say, sometimes penicillin or amoxicillin before it can fully act, and so we have to change medicines to counteract that, so it can be a treatment failure. Fourth is that your child can be a strep carrier, and when they come in with symptoms, they're testing positive with strep. It's not the strep making them sick, it's likely a virus, but you keep testing positive for strep because your child is a strep carrier, and this is where that's the most confusing version and most difficult in terms of navigating through your doctor's office. And the fifth is that you could be having what's called a suppurative complication. Why you're not getting better is because you developed either an abscess or a deep tissue infection from your strep throat, and that's why it's not getting better or keeps coming back. So that needs to be something that can be examined and dealt with through your doctor's office to figure that out. So let's talk about what I think is the most frustrating and confusing, which is strep, being a strep carrier and understanding how to think about that, what to do about it, and how to test for it. So being a strep carrier is actually a pretty common and normal state for a certain percentage of younger kids, it's usually younger children, who are in a classroom setting or group setting where strep is passed around. And what it means is that sometimes in certain kids, the strep takes up residence in your tissues of your tonsils or your throat, but it is not making you sick. It simply lives there, and every time you test for it, you will test positive, but the strep is not making you sick. It is difficult to pass to other kids, actually. It tends not to respond to normal antibiotic therapy, like treating it with the regular strep antibiotics doesn't make that go away. And it is low risk for suppurative or non-suppurative complications, so it's not something that state is not something we are concerned about the way we're concerned about acute strep infection. So, one, how do you know? Well, the most common way this presents is this idea that you keep coming into the doctor's office, you have symptoms, and it can be anything from a runny nose, a cough, a fever, and a sore throat, and they swab your throat and you test positive. And this keeps happening over and over and over. And so at some point, the provider who's treating you should be looking at your child's throat and doing an exam to determine whether this all is consistent with an acute strep infection, or the pattern, the picture looks more like this is a virus, his or her throat looks normal, but we keep testing positive for strep. And then coming back after you've completed a course, at some point, a course of appropriate strep antibiotics, and when your child is asymptomatic and they have a normal exam, and doing a definitive strep test such as a culture or a molecular or PCR test to determine if you still are positive in between symptoms and courses of antibiotics. What is not appropriate to assess a carrier state is a rapid strep test. There's too many false positives and negatives. So you'd want to use specifically a culture, meaning what you put on the plate and send out, or a molecular or PCR test is appropriate for this. And if you test positive in between without symptoms, you are generally considered a strep carrier. So how do you manage a strep carrier? If this is your child, what's the right way to approach this so you aren't constantly on antibiotics, and knowing when to treat it for strep and when to not treat it for strep? So the general approach is that if you wait it out, it will go away. And when your child comes in with symptoms, there should be a more careful assessment of whether this is high risk or low risk for being a strep infection, and using testing and treating only in times where that's high risk. That's assessed using elements of the physical exam and symptom pattern. So if your child has a runny nose, cough, and congestion, not much of a fever, and their throat exam is totally normal, and we know they're a carrier, they probably shouldn't be tested for strep in those visits. And if your child has no flu symptoms, no cold symptoms, you come in and your throat is bright red and you have really inflamed pharynx and tonsils, those kids should be tested and treated perhaps like strep throat because they fit a different profile. It doesn't look like a virus. When do you treat a carrier state specifically as a carrier state? It can be that Either there is an outbreak of recurrent infections in a setting of close household contacts and or classmates or close contacts outside the house, and you need to get rid of the carrier state to know if that's a source. So how do you do that? There are specific antibiotics that are geared towards treating the carrier state. Clindamycin being the most commonly one used. It's difficult to take, but it's effective. When do you take the tonsils out is usually an ENT decision, but the criteria that we use for referring children for tonsillectomy are you have between 4 and 6 confirmed group-based strep infections that you have to treat with antibiotics in a single calendar year in 1 or consecutive years. In addition to, plus or minus, the addition of obstructive symptoms with sleep like snoring, but the snoring doesn't have to be there necessarily if you have these recurrent symptoms and recurrent confirmed strep infections that you have to treat. So I hope this helps. This is by far the most confusing area of strep throat management, diagnostics, and treatment for your kids. And the problem with it from a pediatric standpoint is busy pediatric offices have to often see, 20 or 30 or even 40 kids a day per doctor or provider. And sometimes it's just easier if you see a positive strep test to just keep throwing medicine at it and not think about it. However, sometimes as a parent, you have to stand up and advocate for yourself and say, do we really need to be doing this? Should we be assessing this for maybe he's a carrier and maybe he doesn't need to be on this many antibiotics? Or maybe we should be going to the ENT to be assessed for getting his tonsils out. So don't be afraid to stand up and ask questions because pediatricians are also human and we get busy and sometimes we just resort to the thing that's the fastest and the easiest. So I hope this helped. Love to hear your questions and comments on our website and our YouTube channel. We look forward to talking to you next week.